Welcome to Spark Stories, a monthly program where we find out about the spark that inspired area leaders to step up and enact change to make Des Moines a better place to live. Joining us today is Rob Zlomke, a committed Des Moines street outreach worker who has served at primary health care for the last 5 years. He works as both a case manager with the primary healthcare homeless support services team and as a prevention specialist with the project. So he spends his days doing outreach to support people who are experiencing homelessness and providing free and confidential testing for HIV and Hep C. He has also been offering support to library visitors here at Central Library in 2021, since June of 2021. Welcome, Rob, and thank you so much for being here.
Elizabeth, thank you for having me join you. What a wonderful opportunity.
Can you tell us a little bit more about what your day looks like and what it looks like to support people experiencing homelessness in Des Moines?
Gosh, so my day is crazy, usually from beginning to end. From the start of my day, the beautiful thing about my job is that it changes from day to day. You know, COVID has definitely, caused a great amount of change, but yeah, it's something new. It's a new adventure every minute of the day, and I couldn't ask for anything more. It's great.
And so you actually go out and work in homeless camps in Des Moines?
Yeah. So, Tuesdays, Thursdays, myself and one of my coworkers would go out. We go out, from 9 until 11:30, 12 o'clock, just before lunch, and go and check on homeless camps around the city. Could be behind the levee, could be, off the river. It just, kind of depends. There has to be that communication piece between, those that are experiencing homelessness. Sometimes we catch people on the fly. It just is it's a hit and miss always.
And what gets you excited? What fires you up? What's the thing you're doing right now that's most exciting for you?
Oh my gosh. So I'm excited to tell you that I have also 24 other awesome coworkers. Okay. And they're not paying me to tell you this. They're just incredible. And so at any point, something different or unexpected because of their experiences, right? Something new comes up. I'll tell you a quick story. So this last week, it looked like this. I get a note from another staff member with a name and an address and the property owner, right? Like, okay, well, I'll go check it out, I guess, right? And so that's what, us street outreach workers do. Come to find out, it was an old condemned apartment. And so I went up and knocked on the door, spoke with the man briefly. He tells me, well, I can't talk right now. I'm going to get my vaccine. He's getting his flu shot today. And so I can't, he didn't have the time to talk to me. Okay, that was on Wednesday. Thursday, I told him I would be back Thursday if I didn't hear from him. So I went when we were out on outreach Thursday morning and knocked on the door. I said, hey, listen, man, like you've got to get out of this apartment. This building is condemned. You must get out. They will evict you and you'll be out on the street. You'll be in a homeless shelter. Like, we've got to figure out something. Come with me. Let's go up to primary healthcare at 1200 University, Suite 110A. So anyway, come up with me and we'll do an intake and we'll start to figure this out. I start to hear a little bit of his story, and there was a lot of moving parts to it already. And so anyway, came in, did the intake, found out, some more things about him. He said his rent was being paid. It wasn't being paid. I don't know. He's completely slipped through every crack. And he wasn't evicted, 12 months ago, uh, which is amazing. Anyway, so we were able to, there were 4 moving parts within my office that we were able to put some things together. So we reached out to 2 other community partners that were able to help us put together a couple more pieces. On Friday, we were able to fill out an application for his new apartment, sign a lease, and he moved yesterday, being Monday the 25th, right? So he moved on Monday into this totally new spot without hitting the street, without having to go to the shelter. I would have felt, like I would have brought this guy home with me. I would have felt terrible having to take him down to, to the shelter. Like he doesn't have, supports here. He's from another country. He'd been in that apartment since 2002. From 2002 until about 2012, he was working at a restaurant, fast food, and then had worked a couple of years at perhaps a big box store. He came home to his apartment where he was brutally beaten and suffered a brain injury, ended up having total reconstruction on his right side of his face, and was left, until, police came and found him on his front yard. And so what excites me, and that gets me going, is being able to go in and help this guy. And he is 1000% appreciative of everything that we have done. I'm able to have this impact on other people's lives moving forward, and being able to help them and accept them where they're at, what they're going through. Another story, from today. We're out doing outreach, right? It's Tuesday, and came across this gal waving cardboard at over on Merle Hay Road, and got out. She had been in, and the thing people get frustrated about is that this housing process isn't a quick fix. Like it's never as quick as what people hope for, right? To think, primary healthcare has the keys to thousands of apartments across the Des Moines metro area, right? That's not the case. We don't have any, and nor will we ever. So anyway, you get frustrated after a month, and I'm not into housing and sleeping in their car. Here's an individual that has some significant health issues. Like, come in, like we can help you. Like, by not staying in contact with us, with me, with what's going on, we can't help you. Like, if you disappear, it's assumed that you figured this housing thing out on your own without any sort of intervention. So this individual, is also living with hepatitis C. I'm like, we have providers there over on the east side of the building that can help you with that. Like, let us help you. Show up. Let's work together to help you and get to a better spot. That's what gets me excited, is being able to go out every day, talk with people, accept them for where they're at. I'm so basically, being this street outreach worker, I'm that first face of contact, with individuals out on the street. And so, I think it must have been, this born empathy, that, had been ingrained, from my parents through, 12 years of catechism in the Catholic Church, and accepting people and loving and respect. I don't know what it was, but and maybe it's past books or other influences, that I had, in my life. But this empathy, I feel people where they're at and what they're going through, and being able to be that go between and helping them get to that next thing to help them at that time. You might not get, like I tell them when they come into the office, you will not likely get housing that day, other than if you want to go to Bethel Mission or Central Iowa Shelter and Services. Those will be your immediate housing options. Okay. If you're willing to do the work and work with, us in the process, and do the things that, you've got to do, you know, advocate for yourself, ask for the sun and the moon, and you might not get the sun that day, but you're going to get a whole bunch of other things that you weren't expecting when you leave homeless support services. Guaranteed.
Right. And now you are coming into the central library and doing outreach twice a week, Mondays and Fridays, from 1 to 3. And a lot of the patrons we see here in the library at Central downtown are struggling with various issues. And as librarians, we often just help them when they come and ask for help, and help them specifically with what they ask for. But they are coming to you, and you're getting more of the story and more of the picture of what's going on with some of the troubles that they're facing. So it's been a huge help having you here at the library.
My God, it's been amazing. Since we started this in July, over 600 people, and it's now, October 26th, right? So 600 people that we've connected with, which has been amazing. I just recently started, grabbing a few extra bags from the Red Door, and Rob down there. He's been a great supporter of what we do. We serve and work with some of the very same population, right? And so, I'm like, hey, Rob, can you hook me up with a few extra lunches to bring down to the library? Because we're always running into, people that have missed lunches here and there, weren't able to, or like the other day when it was, pouring rain outside, and, it was slow over at the Red Door. I knew that. And so I figured, we would hook up with, people here at the library. Sure enough, every time I've brought a lunch, we've given away every lunch, that we had that day. We've not brought anything home with us, or else you'd smell like some oranges rotting or bananas or whatever, but it's all gone. You don't ever see that. So we've, I'm trying to think of a really good story. Do you want to pause this while I think of a story from?
Yeah, sure. And I can say Rob was actually our first Spark speaker that was recorded, not ever, but since we started recording these and releasing them on Facebook, Rob is on there. So Rob over at the Red Door.
So Rob and I kind of share the same kind of background. I believe he was, in the Catholic Church. But so originally, I'm not from Iowa. I don't know if you knew that or not.
I did not.
I'm from the great equality state of Wyoming. Okay.
That's right. I guess I did know that.
And so, growing up there, really, I grew up in a town of 4,500 people, give or take. Most of them, there's a lot of sugar beet farmers, families like that. The big store there was Pomida. Okay, if that tells you anything. Like that was even pre Kmart and Walmart and all those other marts, right? And so anyway, small town, really there's nothing, other than high school sports, right? Which I did. But, I was, okay. So when I hit between my 8th and 9th grade year in school, right, my mom had been diagnosed, and it kind of tells my story, but you kind of get an understanding where I got to where I am. So She had been diagnosed with a very rare blood disorder at that time, ITP. You can look it up if you don't believe me. I couldn't ever pronounce the medical term. It's just ITP is how I learned it. But anyway, I grew to hate hospitals, doctors, things like that. So really the safety net for me at that time, because my mom would spend 9 weeks at a time in a hospital, right? And so I would church was my safety net, right? And so I'd go on retreats and lock-ins and do all that stuff. And so it grew up. I'm like, God, that would be such a cool job, right? So after some time in college, I went back to, and I was doing youth ministry. I did youth ministry for 10 years. I had this opportunity. I was reading through like your questions and what inspired you to do this work. Well, so I had a friend in college, right, and with the Newman Center at that time at the University of Wyoming, there was this opportunity to go on this homeless experience down to Denver, and you played the part of a homeless person. And at that time, I did not have the courage, but my friend Christina did. And she came back and just, glowing of this experience and this newfound appreciation for, what it's like to be in this homeless situation. Right. And so I'm like, there have been times here in Des Moines when I first started this, and our friend Will could talk to you about this. I'm like, "God, I would like, maybe I could play that part." And then I was like, not even a good idea. Like, I'm not even equipped for this anymore. So I circled back around and I got into youth ministry for 10 years. And what I did, we did a lot of outreach and we did a lot of stuff at the shelter there in Cheyenne, Wyoming. And then did some stuff down in Denver as a youth group. We took mission trips to Toronto, Canada, to Long Beach, California, Oklahoma City, to Rome, to Germany. Like we've, did all of those things as a youth group, and so I know Rob and I are similar in that I think he had a very extensive youth ministry type background as well,
Mhm.
which I think had kind of helped grow that piece of empathy that had mentioned earlier. Like it just, you kind of, you accepted people, you learned how to, and you became, more understanding, better understanding of situations. And we're not all alike, and we don't have the same story. I happened to be at the University of Wyoming at the time of Matthew Shepard, and experienced that and what it does to a city and what it does to a state, and how it pulls a nation either apart or together depending on what your beliefs are. It's all about experience and being empathetic to everyone's situation. And the homeless people that you see out on the street, they all have a different story, and it's unfortunate that there's not more of people like myself that take that interest, not even take the time. There have been times where I've been out on street corners with individuals that people take the time and roll down the window and shout out a expletive, and get a effing job, you loser. And you're talking about a very tender population anyway. They have very high thoughts of themselves. They have a very low, I would say, a lowered self-esteem. Shouting something like that to somebody that likely hadn't showered for 8 days, like you want them flipping your hamburger down at the fast food. Like, come on.
Yeah, I think I don't know about everyone. There's obviously people who have a lot of negative feelings towards people experiencing homelessness, but I know for myself and people that I talk to, it's more of a feeling of like, I don't know how to reach out and how to start something to support them. I know I was driving the other day and a person who was had their sign out on the side of the road actually pointed to me, and I rolled down my window, and he said, "Your lights are off." And he helped me out, and I was very appreciative of him. And, like, I wish I could have given him some money, but I don't ever carry
Right.
cash. So, like, it's just that question, like, what
Right.
what can I do to help these people, a person I see on the side of the road.
Right.
Um,
I
so
tell you what, you smile at him. You start with a smile. You'd be surprised how far, that goes. The gal I was telling you about earlier, gal rolled down her window. Hey, do you want my fries? Another one rolled down the window. Hey, I've got, all this Capri Sun. You like Capri Sun? And they're handing out those things. It doesn't have to be money. And what I tell people is, as long as you're comfortable with not knowing where your money is headed to, then by all means, share your bankroll with them. If that is a concern, or if that, whatever, you shouldn't, don't give money that way. But you can always throw in, I know I've got kids, in the back seat of my car. And so I'm always carrying like fruit snacks, granola bars, things like that. You can put together, you can go to the Dollar Tree and put a doozy of a bag together with, hand sanitizer and, soap, a washcloth, toothbrush, toothpaste. And it's pretty inexpensive, but it's, those daily things that, we use at home that you don't think about, because we have the tendency to take a lot of those things for granted, right, Elizabeth? Like, we just, I expect to, when I go and get cleaned up, like, there's soap and there's shampoo and all of these things, right? But to somebody that's homeless and every day, like, you don't know if your camp is going to be destroyed or there when you get back. Your tent could get slashed. Things could happen, and things do happen. And let's not, let's not kid ourselves there. Like, it's a very, very real thing. And so just the kindness, or keep your window rolled up and don't make eye contact. But, if you're one of those people that, that do want to make a difference, yeah, and I should step back. That's kind of been, my mantra for the last, probably 25, 30 years. Go make a difference. It doesn't matter, give as much, give as little, give what you got, if you have that to spare. And that's different for everybody, right?
yeah,
Um,
actually, I had a friend of mine tell me recently they saw someone who was in need, and they handed him some Starburst, and his
mhm,
face just lit up. And it was like the best thing to see how excited this person was just to get a bag of candy, and a
yeah,
smile from someone, that it just completely changed his day, you could tell. So she was very
because
touched by that experience.
Yeah, because most of what they experience is rudeness, not this gentle kindness that we have the opportunity, to freely give, right? That just, that smile, here's a, whatever, a bag of chips, or, whatever. I just came from the grocery store. Nah, I don't really need this, whatever. Um, Mountain Dew, or, whatever it is. Like, there's always something that we have that they don't, that they would be, super appreciative of. It doesn't require much but kindness and a smile.
And so it seems insurmountable sometimes. I mean, you make it sound simple, that you can do these small acts of kindness to help brighten someone's day. But for you, at the end of the day, what does success look like? Or what is the vision you're working towards trying to accomplish with the homeless community in Des Moines?
That's a big one. um, so at the end of the day, I want to help as many people do as much, get as much accomplished, as it possibly can. Can we get everybody housed by yesterday? No. Can we prevent, eviction moratoriums from happening? No. But, we are a resource, out in the community. And, you just try to touch as many lives as you can. Like, I don't count that kind of stuff. I don't like tracking those types of check marks, or those types of wins. Like, that's not how I operate. I just, you do as much as you can, and keep moving forward and keep giving until you can no longer give anymore, is all it is. I know I make it sound so simple, right? Like,
Do something every day, right? Just keep
yeah,
moving every day to
like,
do something.
yeah, one of the Mother Teresa, right? She says, you don't need to come to my Calcutta. You got your own Calcutta. Deal with what you got there, like wherever it is that you're at. And I absolutely, adore Mother Teresa. She was an amazing, person. But anyway, like it's so simple. And it really is, but our focus turns, over here to someplace else. And it doesn't have to be. It can be right here in our own backyard. And trust me, there are plenty of homeless here that are constantly moving around Des Moines on a day-to-day basis, trying to find where they're going to lay their head, tonight, every single day.
For a lot of people in Des Moines, it's invisible. I think, you see people panhandling, but do you really know, are they homeless or are they just out getting some extra cash? So that's a question I think people have.
And that's a legit fair question. And here's what I would tell you is that yes, there are some that are out there panhandling for extra cash, right? Because they're living month to month as it is on, if they're getting Social Security, it's $770, $790 a month, something like that, right? And so by the time you pay rent and your utilities and buy groceries and things like that, there's nothing of that 790 that's left over, right? And so panhandling for a couple extra bucks a day in cash. What people don't understand is that the difficulties. So, like many of those that are experiencing homelessness don't have an ID, don't have a social security card, don't have a birth certificate. So, to get into the DMV, you're looking at 30 days wait. To get the social security card, you've got to send in then your ID, which I don't know about you, but I don't necessarily trust the system enough that I would send them my ID, my driver's license, my person, right? In order to get my social security card and think that it's going to return back to me. Like this whole time of COVID has totally, exhausted the system, in that it now takes a longer period to get all of these things, a month to get an ID, who knows how long to get your social security card. And then so then we talk about, these homeless people then going out and getting a job when you can't have any of those documents. It's impossible. What are they? So I know that there are panhandlers that are caught in that situation. It's easier for them to go and panhandle on the corner than the time it takes to get an ID. Well, I can just, this is my job. And some will tell you that this is my job. This is what, I guess this is what I'm born for, I'm like, but no, it really isn't. Let's take the time. Let's make the appointments. Let's get you the ID. Let's jump through all the hoops. And it all takes time. And people don't realize, just how fortunate, we are to be able to drive by and have a driver's license and have all of these things, that it takes, someone that's homeless even, longer to navigate. Just like this individual with the brain injury, like he struggled with, well, what's my next step that I have to, because of the traumatic brain injury that he had, like he couldn't ever get to what my next step, needed to look like in order to be successful in what his requests, were. And he couldn't get there until you find somebody that's able to help finish navigating that system for you, um, Yeah, that's why I get up and do what I do in the morning after I get the kids off to school, of course.
And maybe in the evenings you have time to read some books. Are there any that
That
have
would
been
be
influential?
well, that would be incorrect. I have two girls in softball, right? They play travel ball, so that's reading isn't until later on in the evening. Usually, by the time I'm about really, really exhausted, and so to be completely honest, I can tell you the last book that really one of the last and it's been out for probably 20 years, but that seven habits of highly effective people.
Mm-hmm.
And do you remember any of the habits? I know
No.
I'm putting you now I'm flipping it around and putting you on the spot, but it totally weaves into all of these things that make up my day, right? Being proactive, begin and end begin with the end in mind, in the end game. What's the end game, and what you have to do. Put first things first. I think, every situation is a win-win, and how do I get those? I also go back to this. How do I get when I was doing youth ministry, and it holds true now with in working with the homeless population, right? In that, how do I get to drink from that individual's well, and how do I get to share my well with them, right? And so it takes a lot of time. It takes a lot of engagement with that individual. Like, for example, when I was doing youth ministry, it was, like the athletics, those athletes are very popular people typically, and so I would go to ninth grade girls basketball games, 10th grade, I would go to all of their games. Same with the, junior varsity and varsity boys basketball games, because that's where all the popular people, and so you get, some of those kids coming to your youth group. Look at it, it explodes to 100 people, like that. Same thing, with working with the homeless and what I do, in that, drink from my well, what I have to offer, what we have to offer you at primary health care, and going and spending some time with you to understand what your story is, and that you're important enough as a human person that you do have self-worth and value, and that there are things that you are capable of doing, in your situation. And this is just a momentary time. Let's work through this, and let's figure this out, proactively, and come to, better conclusions than what you have going on right now. Um, you know,
Great. Yeah. So I mean that was a great book to influence how you do your work, and it works. So
Absolutely.
7 habits. That's high. I think that's been recommended by other Spark speakers in the past.
Oh, has it?
I think so. Yeah.
It doesn't surprise me. I mean, it's
And thank you everyone in the audience for joining us today. You might have heard this is pre-recorded. So I hope you enjoyed hearing Rob's Spark story, and that you will tune in for another episode next month. And you can look on dmpl.org to find other Spark stories, or on our Facebook or YouTube channel. Thanks, and have a great day.